Hi, everyone. I'm Dr. Shannon Roznay of Thrive Wellness Center, and I wanted to talk to you today about oral and dental health. So, I am not a dentist, I am a chiropractor, but I specialize in nutrition and its role in health, not only in spinal and nervous system health, but its role in your overall health and well being. And most of the information that I rely on in regards to nutrition and health comes from dentists. So, the two dentists that come to mind, number one would be Weston A. Price. He was a dentist. He did lots of studies in the 1920s, studying indigenous cultures around the world and looking for the key to health and longevity. So he went into these populations and he studied their diets and he studied their lifestyle and he tried to figure out why did certain populations seem to be free not only of dental cavities and um, periodontal disease, but why did they seem to be lacking in all the diseases of modern history, which include things like arthritis and infertility? And what he found was that the populations he studied were relying on what he called a traditional diet. So it's foods that their culture had uh, grown on and developed on for centuries. And basically, it included a high fat content, so lots of fat soluble nutrients and high quality fat in their diet. It also included some amount of organ meat, often raw milk, and of course, fermented vegetables and vegetables that were very bioavailable. Many of them ate a lot of fish and seafood, but all of them had large amounts of these fat soluble nutrients in their diet. So, vitamin A, vitamin D, vitamin E, and they were very much lacking in the processed foods that most of us are familiar with in modern society. And this was a long time ago. This was the early 1900s that he was doing these studies. And as you know, our diets have only gotten more processed, more refined, and less full of nutrients even than they were 100 plus years ago. So he found that they weren't eating white sugar, they weren't eating white flour, they weren't necessarily brushing their teeth either, but that wasn't the point. The point was that it really showed a connection between their fundamental nutrient dense diets and how their teeth formed and were really healthy long term, well into their old age. He also showed a connection to their facial structure, so how their palate formed, the wideness of their faces. They had plenty of room for their teeth to grow and not lots of crooked teeth, and certainly not a lot of decay or dental disease. So that was Dr. Weston Price. And then the second dentist that comes to mind is Dr. Royal Lee. And he founded Standard Process Nutrition 95 plus years ago. It wasn't called that initially, but he is the founder of Standard Process Nutrition. And so he looked also, he was an inventor and a researcher. He held tons of patents for all kinds of different things, including dental instruments. But he did study dentistry, and he saw also the connection that Dr. Price saw to dental health and oral health, and how that connected back to the diet and nutrients that we were or were not getting at the time. So I rely on their knowledge all the way back when they were doing their studies in order to bring that forward now and basically reteach people how to keep their teeth healthy and strong. So the main nutrients that we care about are fat soluble nutrients. But one of the things that we actually use from the standard process line are bone supplements. So a lot of you know about having bone broth, and it's a little more fashionable now to eat bone marrow. But we actually use defatted bone meal in several products from Standard Process. So two of those would include something called Biost and something called Biodent. So these products are excellent sources of real food, Biodent referring to dental. So we use these to keep the teeth strong, remineralize the teeth if they have been lacking in minerals, so the enamel's breaking down or you're starting to get cavities. These can be taken by all ages. So my daughter is 6. She's taking 2 Biodent a day. They can be chewed. Luckily, she can swallow tablets now, so she just swallows them down. And that would depend on the person and what they have going on, but 2 to 6 tablets per day is a typical dosage. Those are also just great minerals. So we need minerals not only for our teeth, but for healthy bones, healthy structure, a healthy heart, healthy brain. But those are great sources of whole food nutrition from standard process at super high quality. The other thing we need is the ability to actually absorb those nutrients. So you need a functional gallbladder to absorb fat-soluble nutrients, and then you need functioning stomach to be able to absorb minerals that are found in things like Biodent and Biast. So you need adequate stomach acid. So if you have heartburn or reflux, often that is actually an indicator that you don't have enough stomach acid. So I know the popular thing is to try to suppress the amount of acid that's happening, but a lot of times if you're eating food and it's fermenting and it's not digesting well, that's actually creating this acid type effect that you're feeling up into the esophagus. So Zypan is a hydrochloric acid product. So taking Zypan with meals, especially protein-rich meals, will help not only to break down protein, but also to absorb and utilize all of the minerals that you're going to be taking in with the good quality supplements. So additionally, we have the idea that we might want to keep the tissues healthy surrounding the teeth. So that would be the gums. So we do care about having healthy tissue and also a healthy microbiome. So one thing we utilize if your gums are bleeding, if your teeth are loose or starting to loosen, and I don't mean when you're 5, I mean when you're 30, then we worry about something called Cataplex ACP, or we utilize something called Cataplex ACP. And Cataplex ACP, vitamin A, vitamin C, and vitamin P. So that is the cofactors that actually make the vitamin A and vitamin C that much more potent and utilized by the body. So this is anti-inflammatory. It reduces inflammation. So if you have swelling, sensitivity, irritation in the gums, but it also helps with collagen production. So the body uses these nutrients to better assimilate and better formulate collagen. So collagen is also important for keeping the teeth really strong and keeping the gums really healthy. Of course, a lot of people know if you have periodontal disease, bad breath, or you have any kind of concerns with your the health of your gums, or the things actually around the teeth, not just the teeth themselves, then we worry a lot about the types of microbes that are in your mouth and that you're producing, because you get some amount of good microbes in the mouth, of course, from what you're eating, like fermented foods, or just as a normal course of things, we have good bacteria in our mouth, but we also can form bad or negative bacteria, pathogens that can cause disease. So if you are someone or know someone that's had a joint replacement or any kind of heart condition, you know that before you can get your teeth cleaned, they ask you to take antibiotics. So the reason for that is because dentists know and healthcare practitioners know that the bugs, if there's negative or nasty bacteria living in your gums, then when they go in and clean the teeth and stir that up, they can actually create a problem with hearts and a problem with joints where you can get an infection that occurs. So they're really careful about having you take antibiotics in advance of dental work. So I think a great approach would be to ensure that the bugs in your mouth are the right kind of bugs and the healthiest bugs. We also know that even if you haven't had a heart surgery or a heart attack, if you have negative microbiomes, nasty pathogens living in your mouth, that is the start or the first step towards heart disease. And this is proven. This isn't a Dr. Shannon thing. This is a medical doctor thing. They know this to be true. So I use really high quality dental products. So you can do oil pulling, and you can add in essential oils. So that's where you chew on coconut oil to pull toxins out of your gums, out of your mouth, and really out of your saliva. Spit that out. Don't swallow it. But we also have high quality products that you can utilize to improve the microbiome in your mouth. So that's all the bugs living in and around your teeth and down in the little pockets along your gum line. So we love a company called Biocidin. So I've been using this for quite a while. It has really great quality botanicals, which is just plants, right? So some of them you'll recognize and some of them you won't. So we have 2 different kinds of toothpaste. One is more for enamel building. One is just more for the microbiome. They both address the microbiome. This product is called Dental Sedin LS, and this actually has, it's a swish. So you put a couple of pumps in your mouth. It's like a gel, and you swish it around. So it would replace mouthwash. And this is, again, to rebalance, freshen your breath, but rebalance the microbiome in the gum tissue and around the teeth to keep you not only having good oral health, but good overall health. So to prevent heart disease and other issues that can arise from a bad gum issue. So if you're swallowing saliva every day, and it's up to a liter of saliva that we produce and swallow every day, that saliva, if it has negative pathogens or negative microbes in it, that's going right into your gut. So even chronic gut issues, chronic digestive issues, chronic joint issues, things like that, we do care about the oral health in relationship to all of those things as well. And nobody loves getting dental work, right? So the least, more we can avoid that, and the least of that we need, the better. So this is called Dental Sedin LS. Okay, all these products are available on our website or here at Thrive Wellness Center. And this really, as I mentioned, would replace mouthwash. So there's actually really negative effects to utilizing over-the-counter mouthwashes. So it actually increases your risk of heart disease and increases your risk of many diseases because it is killing off the good bugs in your mouth. So there's a connection between using something like Listerine and bad health. Okay, so just, I don't recommend those things. You can use essential oils. You can use oil pulling with or without essential oils. You can use a product like the Biosedin products. Those are going to be much safer. Those are going to have a positive impact on your long-term health. Whereas using over-the-counter fluoride-filled, chemical-filled toothpaste and mouthwashes are actually doing you a disservice. So even though you love the minty freshness and the foaming of your crest whitening, I'm here to tell you it is not doing you any good, and it might be actually hurting you. So I think I would really be remiss if I didn't mention somewhere in this video that you probably shouldn't eat too much sugar if you would like to have healthy teeth. I know you're shocked that I said something like that, but we know that obviously eating sugar feeds nasty bugs, okay? That's wherever they are. I don't care if they're on your skin, in your nose, in your throat, on your teeth, in your gut. Eating sugar and things that turn immediately into sugar will cause those microbes to overgrow. That includes parasites and fungal challenges as well as bacteria. So we don't want to be adding fuel to the fire, okay? So if you're already trying to improve your overall health and the health of your oral microbiome, you don't want to be eating sugar. So there you go. I didn't forget. You thought I was going to forget to mention it, but I didn't forget. So we want to limit sugar. We want to keep healthy oral products that we're using on a daily basis. And we want to be sure that we're getting enough minerals, digesting and absorbing those minerals, enough fat-soluble vitamins from a good, healthy fat diet. It doesn't have to be high fat, but you have to include fat in your diet. And then, of course, we want to manage inflammation and improve collagen formation with that Cataplex ACP. I hope this was so helpful for you. If you have questions, you can put them in the comment box below. You can certainly call us or email us. Our website is also linked below. And otherwise, I will see you soon.